building a better Bay Area for a safe and secure future. This is ABC 7 News.
All right, I'm Kristen Z. Welcome to our daily program called Getting Answers. We're asking experts your question every day at 3 o'clock here to get answers for you in real time. Today, we will get answers about unemployment with EDD spokesperson Lori Levy. I know you have a lot of questions for her. Many of you still waiting for your unemployment benefits. Many of you still having a hard time getting through. So we'll address those in a minute. But first, you might have heard Governor Gavin Newsom held a press briefing today saying we may have to get ready to revert back, as in go back on all the things we've reopened in the past few weeks if the spike in COVID-19 cases continues in California. And he made it clear that we're seeing a spike. Over 7,000 new cases yesterday. The day before, over 5,000 new cases. The day before that, over 4,000 new daily cases. So we're talking about a trend in the past week of many, many more new cases than we saw in April or May. So that is disturbing. And part of the governor's message is that if we don't reverse this, he may have to shut down the economy again. So walk us back, just as the Bay Area economies are starting to reopen. In fact, the governor pointed to California during his news conference, and the Bay Area in particular, saying that we were later to reopen, but now we were starting to see the impact just in the last few days, in the past week, of numbers starting to go up. Not just the number of new cases, because that can be attributed to testing, but also the test positivity rate is over 5%. That is bad. That means not just more people are getting tested, but the people who are getting tested more are turning up positive. So we will talk with Alameda County's public health officer about the implications of all this in just a moment. But right now, we're going to switch gears and talk about something I know a lot of you are still struggling with, and that is getting your unemployment benefits. In California, millions and millions of people still applying for benefits and just having a hard time either getting through to the development, or I should say the department, or getting your questions answered. So joining us is EDD's Lori Levy. Good to see you once again, Lori. How are you?
Good, thank you. Good to see you again, too.
Yeah, thank you. So I want to start with a case of a Morgan Hill man that's been getting a lot of attention since our Michael Finney did a story on him.
Okay.
More than two months, almost going 3 months. And, you know, I've depleted my life savings.
So basically, he's saying he's been waiting, There was the whole identity verification issue, which for him meant, you know, he sent it all in, his W-2, his bank statement, ID, and then it's been 3 months since that happened, and he's been waiting ever since. And that is the top story on our website right now. So we talked to several people. This seems to be a case that applies to many. What is happening? Why, after the identity verification that he sent in, has it been 3 months, he wonders, and he's gotten nothing?
Well, again, I don't have the specifics in a particular case in front of me, but I can first of all say that's heartbreaking. We don't like to hear that at all, which is why we have been redirecting hundreds of people to help us with all aspects of this avalanche of claim load activity, in addition to hiring about 4,800 people just to help us bolster our ability to serve a record number of people in just such a short amount of time. So hang in there with us. I will tell you that unfortunately what happened with identity validation is that a lot of people have been making some common mistakes. So that particular work queue has just exploded because of a lot of these mistakes that have put people there unnecessarily, getting their social security number wrong, putting their birth date wrong, and not even using all the names that they typically use in their employment history. All those things have kind of got this work queue all kind of larger than usual. So I will tell you that we have redirected lots of people to this particular issue. We're inputting different strategies every day, and we believe we're going to be able to wrap a lot of those up here shortly. So hang in there with us. We're working and triaging as best as we can.
Yeah, and last time we talked, you said something that slows down a lot of these applications is when they make a mistake. So you urged people to double check and triple check. But if that's the case for him, if it's been 3 months, wouldn't he have gotten a notification that there's been some sort of mistake? That can't be it for him, right?
Well, what I'm saying is that unfortunately, a lot of these mistakes have just gone and made this work queue that has to be manually done extraordinarily large. So it's difficult for us to get through all of those and kind of sort out the ones that truly have some issues. So we are working with that. Again, we have redirected even more staff to this particular issue. We're working on being able to upload documents and a lot of other things that'll make this much more efficient. But we are trying to follow up and triage with those who have really been hanging there the longest with us and trying to get some kind of update to them as soon as possible.
All right. Lori, I also have a question. Actually, this from a colleague of ours here at ABC7. His wife Rose's claim was accepted 7 weeks ago, he says, but she never got an email with a customer service number. She admits that she made a mistake on a question about whether she had worked last year and thinks that's what's holding up her claim. Now, somebody advised her to file a new claim, but she's afraid EDD will view that as fraud. So she's tried to call but cannot get a representative by phone. What should she do? She wants to know how long should she wait for a response to the first claim? Should she refile? What do you think?
You know, I was just helping somebody with a claim. They were a self-employed individual. They had filed in early April and were wondering what's going on. I said, well, if you truly have self-employment wages, then you really needed to reapply after April 28th. Because before then, we couldn't really entertain any 1099 wages for eligibility. We could only look at W-2 wages, those reported by employers. So if this is one of those cases, she may be a self-employed individual and she applied before April 28th, please do not hesitate. Go in and apply right away through our UI online system if that happens to be her situation. Again, I'd have to get some more specifics trying to triage what may have happened with her. But in essence, it really kind of depends upon when you filed, when we had those particular programs in place, and how we can proceed with your particular eligibility.
All right. Nikki Loza has a question on Facebook right now. Let's see. If Ross reopens, I guess that's where she is, but can't work because I have a 1.5-year-old baby and an 8-month-old, would I still qualify to receive unemployment?
You know, it really is kind of dependent upon a case-by-case basis. We look at whether or not you have good cause to refuse work, because you must be able and available to work in order to be able to be eligible for unemployment benefits. So if you meet what's considered good cause, like you have tried everything and you have no way of getting childcare, then that's something when you report on your biweekly certification form that to that question number 4, did you refuse work? Yes, we will go ahead and follow up with you, follow up with the employer, and make a determination about whether or not you do meet those good cause provisions and could still be considered eligible for unemployment benefits.
All right, Lori, I'm going to ask you to hold on for a second. We're going to take a short break on the air. When we come back, we do want to bring in the Alameda County Public Health Officer to address the spike we're seeing in the Bay Area with COVID cases. But keep sending in your questions for Lori, because she's going to continue to hang out with us and answer them. Lori, thank you, bless you for doing this. I know it's helping a lot of people. We'll be right back on air.
We're in commercial break.
All right. Thank you for joining us today, folks on Facebook. Sorry, we're jumping back and forth a little bit, but we have 2 very big stories for you. It's always great to talk with Lori Levy from EDD to help you with your claims. But at the same time, we also want to address Governor Newsom's announcement today that California may have to go back, as in close things up again, if our numbers trend in the direction that they're trending in now. So we want to bring in Erika Pan, who is with Alameda County's Public Health Department, to really talk about what's happening here. All right, let's see if my producer has a message for me. All right. All righty. Dr. Pan, how are you?
Okay, how are you?
Good, good. Thank you so much for joining us. I know it was rather last minute, so I really appreciate it. Folks, Dr. Erika Pan is with us. She is the Alameda County Public Health Officer here to address the increasing new COVID cases here in the Bay Area and in California. You probably heard Governor Gavin Newsom's press briefing, I guess you can call it a press briefing, earlier today, saying that if we don't do something and, you know, everybody wear masks, we're going to have to possibly face the consequences. Dr. Pan, would you say, what is your #1 urgent message to people? Is it wearing masks? What is it? I mean, because I seem to think that people here in the Bay Area are already doing that.
Yeah, thanks for the questions. I think, I think it's all the things we've been emphasizing. Certainly face coverings are very important. And actually, anecdotally, even here in the Bay Area, I don't see everybody wearing them. So I do think this is a really important public health measure that we can all be doing. And in addition to the physical distancing, we know that there has been what I would call intervention fatigue.
All right, Dr. Pan, hold on one second because we're coming back on air.
5, 4, 3, 2.
All right, welcome back. Joining us now to talk about the impact in the Bay Area of COVID-19 cases going up is Alameda County's Public Health Officer, Dr. Erika Pan. Dr. Pan, thanks for joining us.
Sure, thanks for having me.
Yeah, so we heard Governor Newsom today talking about how in California the past day we had 7,000 new cases, and also the day before over 5,000 new cases. So this is a trend. They are certainly going up. If you look at the last 7 days, each day the average is higher than what we saw in March, April, May. And here in Alameda County, I looked this up, and you correct me if I'm wrong, but it seems like on June 22nd you had 202 new cases, and June 23rd you had 133 new cases. So look, your cases are growing in Alameda County, and you've been trying to be careful. You've opened up more slowly than most counties. What gives? I mean, are you very alarmed at this point?
So there's a few things I do think are happening. As mentioned, we have been reopening very slowly, and a lot of the cases we are seeing are in sectors that had already been opened even previously. So we're seeing a lot of cases in essential workers, a lot of household contacts of people who live in crowded living conditions. So that is part of it. We're definitely expanding our testing. We are actually close to our testing goals, which certainly means identifying more cases. The other trend here in Alameda County that we're closely following is our hospitalizations, which are usually a time lag, but we had a lot of concerns at the end of May that our hospitalizations were on the increase, and then they slightly decreased and have been very stable for the last several days, at least, while we've seen this increase in cases. But we are, of course, very concerned that the next thing to follow could be increasing hospitalizations. So we're following this very closely along with other things. I think some of this, again, is being able to find more cases with more testing, but some of it absolutely is people, who maybe aren't following up with face coverings. I also would really emphasize for every business owner and every employer to really be making sure your employees in the workplace are following, all the safety precautions that we in the state have provided to really try to make sure that workers and customers are protected.
Well, look, this is happening at a time when we are reopening. I mean, your county, just 5 days ago, you revised your order to allow more activities to resume, right? They include things like small social bubbles. They include things like religious indoor gatherings of up to 100 people. They include some face-to-face retail interactions in stores. I'm wondering, when you made that decision, what kind of data were you looking at that made you say, okay, we can do these things and reopen a bit? Because it seems like 5 days ago, those numbers were no better than they were when we went into shelter in place and shut everything down.
Yeah, so again, we look at a lot of different factors for these indicators. And we, as you mentioned, have been basically the slowest county, I think, certainly in Northern California. And what we are looking at is the prior 2 weeks or so. So we did some level of reopening on May 4th and then again on May 18th. And then after May 18th is when we started seeing an increase in hospitalizations here in Alameda County. So we didn't actually open up much in early June because of the increase in hospitalizations we saw at the end of May. And then those actually decreased a little bit and have been very stable. Our hospitalizations have been really only up or down by 1% over the last several days. And then we just literally saw this spike that you mentioned in the last couple of days after we had made some of those other decisions. And I think we continue to balance the need for, all of the sort of downsides that have started to show up the longer people have been sheltered at home and reopening and with the things that people want. So really our emphasis at this point is that we want to continue to suppress this virus, and we've all got to learn to live with this virus. And we look at the variety of indicators I started to mention as well. We've certainly expanded our testing. We're actually just about very close, over 90% of our way to our testing goals. And with that, the good thing about that is we're finding all these new cases and then working on, making sure we can isolate those cases, make sure we their quarantine. So the other thing we've been doing in all that time that weighs into our decisions about when we can slow down or speed up, or we've not sped up at all because we've been concerned about all of this, but we're looking at our public health workforce and our ability to follow up on these cases and contacts. So we did slow down in May because of both the worry about the increase in hospitalizations. So spending some time, we're in transition right now to a state platform and transitioning the way our teams are going to work to be more efficient, and really then going to be accelerating our workforce in the next few weeks.
Dr. Pan, we seriously don't have any more time, but I've got to just real quickly ask you this. You're urging folks to, keep up with the social distancing and wear their masks. If people don't, and if the numbers, go in the direction that you don't want them to go in, are you ready to walk back on some of these loosening of restrictions? Are you ready to jump back to closing up restaurants and stores?
I think, there's a few step processes on this, and sort of on one hand, this virus certainly moves very quickly, but just sort of like the state has mentioned, there is sort of a monitoring tool with various indicators looking at case rates per 100,000, what our hospital capacity is, what our personal protective equipment capacity is. So if we got into a sort of monitoring mode for that, then one of the next steps is, again, to look at what's happening in that community or county. What else can we do to be more aggressive about the interactions? And then if that still was not working, then that would be the time to consider reversing any measures. So I think there's a few steps in between, and thankfully here in Alameda County, we haven't yet reached those triggers yet for concern about being kind of on the level of needing more aggressive interventions, but we are certainly monitoring closely, moving as slowly as we feel, along with the community demand and the economic demand to allow for something to resume.
It's a lot to balance. Dr. Pan, thank you so much for your time today. Really appreciate it.
Sure, no problem. Thank you.
We're going to take a short break on the air and then be right back with more. This time with EDD's Lori Levy. She'll be back.
In commercial break.
All right, Dr. Pan, thanks again. I know it was short notice and we didn't have quite that much time, but still, nonetheless, good information. All right, now Lori Levy is back with us, and in fact, she never left us, which is why I so appreciate this. Lori, I hope you enjoyed that conversation too. I find it hard to wrap my head around it because I think on the one hand, a lot of people are going, yeah, well, we did expect these numbers to go up a little bit, but then maybe not that much. It is worrisome. And of course, all of this has an impact on you because as people continue to suffer, this pandemic continues to be with us. You're still having a lot of people out of work and filing for claims. And I know you guys are just as swamped as ever. Or actually, correct me if I'm wrong, is it slowing down for you as the economy starts to reopen, or is it not caught up yet?
I don't think it's caught up yet, and I do agree with you in the balancing, a very extraordinarily difficult balancing act between really protecting your health and protecting your economic health. So it has been truly a challenge. We continue to see, we were paying out big amounts of money and benefits, over $3 billion in 1 week. During the Great Recession, the most we ever paid out in a week was about $542 million. So it truly continues to be a very, very busy time, extraordinarily busy time. But again, at the same time, we're hiring about 4,800 new staff now that we have more federal funding. So we're hoping all of that does lend us a big hand.
All right. How much time do we have before we go back on air, guys?
20 seconds.
Ooh, 20 seconds. Let's squeeze this in super quickly, Lori. Reagan wants to know, what's the turnaround time on fixing common mistakes and getting money distributed? 10 seconds.
Basically, all depends on what it is, and we're working to make sure that people get ample opportunity to do so as quickly as possible.
Oh, listen to that time cue following former news anchor. All right, we are back with Lori Levy from the EDD. Lori, thanks for sticking with us through that conversation about COVID cases in Alameda County as well. More questions coming in during that time. I'm going to start with this one from Facebook. Myself and many others I have talked to have 4 weeks or more of pending certifications. We have not received any payments. What should we do?
We're finding a lot of people are in a pending status and sometimes unnecessarily so. So we're actually getting out some more education, including our news release scheduled for tomorrow, about how to answer those questions on your biweekly certification form. For example, we're seeing a lot of people mistakenly answering, were you too sick to work? that question number one, and they say yes, which disqualifies them from benefits. And when we follow up, they say, well, no, I wasn't sick. It was just all this COVID out there. So the second question asked, was there any reason why you weren't available for work other than sick or injury? And people say yes, because of all this COVID. Again, you just need to be available and be ready to go back to work if indeed the business opens and you're called upon. That's all that question asks for.
Okay. Diana Reyes Martinez wants to know, I was furloughed in May and then got laid off in June. Do I have to fill out a new claim or do I just continue certifying my weeks?
I believe you're going to be just continuing certifying your week. So if you opened a claim and it was based on you were partially unemployed, and then at some point in time, you probably want to say, were you working or anything during your biweekly certification? And you would enter at that point, no. So that might be something where we'd have to follow up with you with a determination interview. If that's the case, you'll certainly get notice from us. And at some point, if you're fully unemployed, that might be an increase in your benefit amount. So be watching for that, and that's something we may have to work with you on a case-by-case basis to go ahead and adjust if necessary.
Okay. Can you describe the FedEd extension, obviously looking at the deadline?
I got to tell you, there's so many different confusing elements out there about unemployment with all the new federal elements and provisions. There is a different, we have right now a pandemic emergency unemployment compensation extension, this new 13-week one that Congress put in place during the CARES Act. But there is also an existing extension that kicks in every state when unemployment reaches certain levels. And it's called here in California, the FedEd. And it can be up to about 13 additional weeks of benefits, sometimes higher, just depending upon legislation in play at the time. So we are going to be getting out more information on that starting probably tomorrow and into next week. The first time someone could be eligible for that new FedEd extension is when you've run out of all PEUC extension benefits. So you had to go through your regular claim, your PEUC extension, and then you could be found eligible for FedEd. We'll be sweeping our systems and automatically doing that for people who fall into that category.
Laura, it's like you can read my mind. You just answered the next question, so I'm going to skip ahead to the next one. Then, do you know why so many school employees are having their benefits held up as of June 13th?
That's a very good question, and we do have an FAQ on our news on our website to address exactly that, because we know this affects a lot of people. Basically, what the federal U.S. Department of Labor has told us is that we must treat this summer like any other. So if a school employee normally has some kind of assurances that they'll be going back to a job in the fall, then they are not usually eligible for unemployment during the summer. So that is one of those cases that if you're one of these individuals and you believe that your assurance of return to work may not be so solid, go ahead and continue to, to check in with us on that. You can appeal that decision, or you can certainly ask for more questions, follow up on your UI Online account to contact us and ask a little bit more information about that.
Okay, Becky has a question here. She says, I was receiving money, and now this 2-week cycle, they say, because I checked the box saying not looking for work, I was denied. How is that possible? I have a job as an in-home person for a special needs child if the parents aren't allowing anyone in, so therefore I'm unable to work.
Yeah, I think if you're, it's a different question. Are you available for work? That second question I was talking about just a moment ago that says, are you available for work for any other reason other than sick or injury? Could you not be available for work? And you really need to answer if indeed you are available and able to work if called upon, and if that job is there for you, you do need to answer that, yes, I am available. Because if you're not available, that's when we are required to find you ineligible for benefit payment in that particular week. So we are getting some further information out there to help clarify that for people. So really stay tuned to our website for some more details.
Okay, Julie wants to know, once I'm approved and my payment says it's been paid, when should I expect to receive the debit card?
So if you're a new claimant and you just had your initial application processed and you're getting your first payment, you've submitted that first biweekly certification saying, yes, I'm unemployed and otherwise eligible, then we ship out that EDD debit card to you, and it should arrive between 7 to 10 days. And then from that point on, every 2 weeks when you certify telling us you remain eligible, that benefit payment gets posted directly to that card and usually arrives just within a day or two.
Okay, here's a question from Brenda Thompson. She says, if I'm a commission associate and my commission is paid, but if the item is canceled, the commission amount will come out of a future paycheck. How or when do I report the commission that I'm paid on? Also, if my hours are impacted, but I'm back at work, do I still get the $600? Ooh, that's a confusing one.
That is a confusing one. Again, I would probably have to look at the particulars on the case, but I will tell you in terms of the $600 federal stimulus payment, as long as you're getting a payment, you're qualified for a payment in that particular week, whether that's a regular unemployment insurance, a pandemic unemployment assistance, a benefit, or even a PUC, we will automatically add that $600 to that benefit payment. So it does all depend upon when you earn those wages, how much in wages you earned in that week. If you've earned too much in wages that week, it could negate any of your unemployment benefit that you would have received. And then, unfortunately, if you have no benefit payment for that week, we wouldn't be able to tag on that additional $600.
All right, Chastity has one, and I'm not sure you can answer this, but I'm going to try. My employee was receiving benefits and then stopped with no notice for no known reason. I'm not disputing her claim. She has sent emails that go unanswered. It's been impossible for her to get through. People are running out of money, and we're told that thousands of EDD employees are being added. So what is happening?
You know, I think it's just there's so much volume of people trying to get in any certain time. We understand it's extraordinarily to get through on the phone and difficult to get through on the phone. And we are adding personnel to that. We've been working to triage this as well as we can. So hang in there with us. We are trying to get to all of that. But it really all kind of depends on what you're answering on that biweekly certification form. And it's really important people do get information about that process. We have some really good video tutorials on our website in 4 different languages. I think a lot of people, this is so new to them, they haven't necessarily read up on that certification process. And it's really important to understand what those questions are and how you answer them so that you don't experience any interruption in your benefit payments.
Sure. I mean, this is the first time for a lot of people, right, Lori? So there's definitely a learning curve. Okay, we're almost out of time, so I want to go over this again. I know we talk about this every time you're with us, but what is the best time to call? What is the best time to try to get through?
You know, we continue to try to triage and actually update our call center platform as well. So all that's happening on a daily basis. So in addition, as we bring on more staff. So it really is evolving daily, kind of building that plane in midair type of situation. But generally speaking, it's best to try to get through before 10 a.m. in the morning and after 5 p.m. at night.
Okay. And then, look, you continue to hire people. Is that still the case? Last time we said, hey, they're hiring. Are you still?
Yes, please. And if anybody does have interest, we do have a great page right there available on the front page of our EDD website at edd.ca.gov. We are hiring 4,800 people at least over a period of a matter of weeks. So it's an expedited effort. And you'll find lots of good information about what all those different jobs are. We've already hired and brought on board about 1,200 of them.
All right, Lori, thank you. Always good to see you. Take care. Talk again soon.
Thank you, you too, and everybody else out there.
All right, take a short break and be right back.
We're in break.
All right, do we have one more question for Lori, or are we done, guys? Oh, okay, Lori, we have 2 more minutes. Are you good with 2 more minutes?
Yep.
Okay, awesome. I'll try to get another case in here. Let's see. Tracy says, I got an extension on my unemployment benefits that I have 3 more weeks on. Is EDD going to offer a second extension for those of us that cannot work due to the pandemic? Yes, right?
No, good question. And that's kind of like that Fed Ed extension I was talking about. It operates a little differently from the PEUC extension that you're on now. And you're going to be seeing much more information about that because we're going to be automatically processing those Fed Ed claims for those eligible in our system. So lots more information coming out between tomorrow and next week on that. Because I think next week will be the first week somebody might become eligible for that new Fed Ed extension.
Okay. Joanna says, I was approved, sent payments, then my payments just stopped, called and was told I would have to reapply in September. Why might that be?
Oh, that's a good question. And again, I'd have to kind of look into the particulars of that case to be able to answer that one. I'm so sorry. There's a number of different things because each case is so different depending upon your employment history. 2 people could be working side by side, but have some different things in their employment histories that would make their eligibility a little different. So I'm afraid I don't know the answer to that one right off the top of my head.
Okay, thanks for trying. Mikhail Orleans wants to know, I want to cancel my EDD. What should I do, please?
Yeah, somebody's gone back to work, which is great. We're glad to hear that.
Yeah.
All you have to do is just stop certifying for benefits. If you stop certifying for benefits, what it does is it just puts your claim on hold. You have up to a year to collect those benefits that you're eligible for. So some people do start off collecting, go off it for a while, and then come back on later. So that's always possible. You just have to reopen your claim at that point.
All right. Lori, before we let you go, once again, the website is?
edd.ca.gov, and there's a great page of information, top FAQs. I really encourage people to check that out. We're trying to keep it updated as much as possible.
Thank you, Lori. See you later.
3, 2.
Thanks for joining us today. Bye-bye. All right, Facebook friends, thank you for tuning in today. Hope we got some of your questions answered. Catch you next time.
Thank you.